Good morning, and thank you all very much. Greetings from, good morning, and greetings from Canada, where it's afternoon here. And I'd like to thank you all very much for inviting me here today. And I'll just get my screen. I hope this is all clear. I should be in presenter mode now. So what I would like to do today is, first off, thank the organizers very much for having me here to speak to you. And I was asked to speak to you. I think you have a very important program, and I'm going to speak to you a bit about the evidence that I know and how that evidence was used to shape food and nutrition policy in Canada. And that's the area that I really work on and familiar. And I hope you'll take a couple of these examples. And the examples from food and nutrition are important because it really was a commitment of the federal government of Canada to make an effort to reduce the scourge of obesity and chronic diseases in our country. And there was a large shift that happened, and I think this is really seminal, that occurred in 2004 with the release of the report from the WHO called the Global Strategy, Dietary Recommendations for Food. And this was a seminal report because up until that time in the early 2000s, the WHO had spent most of its efforts really focusing on the communicable diseases. And this really signaled a shift of the importance of the non-communicable diseases, our chronic diseases, and that they weren't just diseases of the affluent and wealthy, but also of the developing world as well. And one of the key aspects of this report was really focusing on, if we were going to reduce obesity and chronic diseases, there were a number of nutrients that we had to start limiting in our diet, and also increasing consumption of things like fruits and vegetables, legumes, whole grains, nuts, and seeds. And if we're going to take these types of recommendations and shift them into policy, we really want to start saying, where does the science fit? And you really need a series of a good scientific research studies, which then roll up into a number of what I would call reports. And these reports, and some on the left, are reports out of the World Health Organization. That the first one is the Diet and Chronic Disease, but focuses on sodium, trans fats, other nutrients, and how they were relative to risk for chronic diseases. Other key reports that built our science into, how did our science then get reflected into setting nutrient requirements for a country, which in then turn get incorporated into a number of policy documents. And then the third set of evidence comes not just from the research community, but I would also say from the health and consumer health advocacies. For example, a report from our Heart and Stroke who said our children in Canada aren't doing well. And in actual fact, children are going to start living shorter lives than their parents if we don't deal with obesity and chronic disease. And then other government surveys that looked at the health measures, the nutrition of our population. And many of these analyses were not just done by government, but had a huge role by your academic researchers in analyzing these large national surveys conducted by government. And so now, when these reports happen and when this science is out, you really start saying, how do we take the science and incorporate it into action and implementation plans? And I think we have to remember that when we start taking our science and moving it into implementation and action, it can happen at multiple levels. We see it first at the very highest levels, international things, for example, UN Decade of Action on Nutrition, and scientific reports, expert reports, but we also see it at local, regional levels. For example, I chair a sodium work group for the Pan American Health Region on sodium reduction, but there are many, for example, Europe has released a recent report on action plans to help countries reduce the marketing of unhealthy foods to children, and released a toolkit. And we also have national activities that, for example, I led 2 large strategies in Canada on reducing trans fats and sodium. But we also, most importantly, we also see very important action happening at the local level. And often federal and national governments are slower to action, but you see some of the earliest interventions such as menu labeling and sugar sweetened beverage taxes. Those types of policy actions happened at the most local of governments, and then they in turn migrated up to eventually become national policies. So I think your research has home in many areas, both at the national, international level, but don't forget that action often starts at the local level. So I'm going to briefly say that when we talk about action, the earlier actions of governments really were focused on what I would call information-based rather than action-based. In other words, our earliest recommendations and regulations in the nutrition area were really around things like nutrition labeling, producing food guides, but these are non-regulatory actions. So really, these are actions where the onus is put on the consumer rather than improving the foods and improving the food supply. And I think what we've learned in the last 20 years, that if we're going to have successful changing our research into policy action, it really has to start addressing systemic changes in our whole food system. And that's some of the things I will talk to you about today. And I'm going to give a couple of examples. I led these 2 task force or working groups in Canada. But I think if we're talking about partnerships and getting research into practice, we often have to involve other groups, be it the food industry, agriculture, and business, and have them involved with the health agenda. But I think we have to keep in mind that the health agenda must be led by health, with the majority of members coming from the health sectors, or we won't have a true health policy. It will become an industry policy or an agricultural policy. And if our key objective is the health of the country, we want to have a health-focused policy. And you can see the membership of these panels were, by and large, led by health groups. So I'm going to give an example about trans fats. And this is an example that has a long history, but I think it's a good one to show how we moved from science. This was research done by a number of groups, and these were scientific researchers in country. And by the late 80s and 90s, we knew that trans fats were bad, increased the risk of heart disease. But data coming out from Canadian researchers showed that we were actually the champions of the world. We had the highest intakes of trans fats anywhere in the world. So what can be done with this type of information? So the government, the first thing they did was introduce mandatory labeling. So we were the first country to require that trans fats had to be declared on the label, and also indicated a regulatory requirement for if you wanted to declare a food as free in trans fat, it had to be below a very low level. And it was significantly lower than any other country that even subsequently introduced levels. But that really wasn't enough. And by 2005, we realized that with the changes of nutrition labeling that had been introduced in the early 2000s, we still had some of the highest intakes of trans fats. So a trans fat task force was convened, and after 18 months, the task force said that the only way to reduce and get rid of trans fats in Canadian food supply was through regulation, and the task force proposed limits. But at the time, our minister decided that this government at the time was not favorable of regulating the levels of trans fats in the food supply, so instead voted for monitoring the food system. Now, here's a case where I think I want to show this slide, and this is some data from the monitoring system, and there were about 50 pages of data that were released every 6 months. And this was we made a commitment that all the monitoring in the country would be transparent by company and by brand name. And it really did lead to change. And if you look at the numbers here, these happen to be the trans levels in French fries. And you can see that there was one company that was quite slower than all the others, and it took them about 3 years. And in this case, it was a Heart and Stroke Foundation who had anointed them and gave them an award as the king of trans fats. And subsequently, within 6 months, the trans fats were also eliminated out of the French fries in this country. So you can see that evidence, not only was it basic scientific evidence, it actually led to, in this case, very, very quick change in the case of one food industry and one company. And over the course of 4 years, as we continued to monitor trans fats, we actually had a fairly good success, that we achieved about 75% of the food supply was then meeting the trans fat limits. But that progress was varied. As you can see, many were reaching close to 100% of their foods in that category, but others were mediocre, and a few were still having troubles meeting the low trans fat levels. So then when I came to University of Toronto, one of the things I did was I set up a food label database. And this collected food labels from all the large major retailers in Canada. And we collected food labels every couple of years. But this allowed us to see how the food supply was changing. So in 2013, we actually reconnected trans fats, even though the government terminated the trans fat monitoring once they hit 75%. We continued to look, and sure enough, by 2013, the food industry had now reduced 93% of the foods no longer contain trans fats, although there were still a few problem categories, as you can see here. So what happened? This is just a bit of a time journey with something like that. When we focus nutrition and get it changed from research right into policy, we first knew the troubles with trans fats in the early 80s. By the 90s, we knew how high they were in Canada. We had some modest regulatory changes, but it took 11 years before we finally had regulations passed to ban the use of trans fats in Canada, and there are no longer trans fats in the Canadian food supply. But that was a long journey, and if we're talking about trans fats, we really want to start saying, well, our food supply is also high in sugars, sodium, and saturated fats. Are we going to go on a 20-year journey for each of these nutrients? And that's where the research and the policy really starts changing into what I would call a dietary patterns type approach. And then the policies also shift. So what we've really moved the shift, and we've shifted the responsibility for creating policy from what would be individual responsibility, things like food guides, regulating limits, to regulations, to now wanting the whole food supply to change, where we're developing food policies and research that looks at the composite of the whole food supply for healthier populations. And so this led to the introduction in 2016 of the Healthy Eating Strategy for Canada. And the Healthy Eating Strategy is different from the trans fat or what we did with sodium, was it is integrated, and it's a suite of policies, realizing that no one policy is going to successfully reduce our rates of chronic diseases and obesity in the country. So it had a number of components, and I listed some of them here. So we did update our food guide, much more emphasis on whole grains, fruits and vegetables, reducing the intakes of processed foods, a new nutrition facts table on foods, updated news levels or sodium targets for foods. We have the trans fat ban, which I've shown you through. We also, very importantly in Canada, had an evaluation of the food subsidies in Nutrition North. In other words, the food programs that support our First Nations and Indigenous populations. The evaluation has been completed, and now that's leading to a whole program shift and overview. And we had two other important initiatives. The government introduced in 2018 regulations for mandatory front-of-pack labels on all food products that exceeded thresholds for sugars, saturated fats, and sodium. However, the regulations have only got to the first phase, and we still require phase 2, part 2, for them to be implemented, which we're awaiting this government to do so. We just had an election a couple of months ago. And finally, the other policy remaining in that is regulations to restrict the marketing of unhealthy foods to children. But I think important as we look at this is a whole suite of policies aimed at how do we make the food supply healthier so that the healthier choices are the easier choices for Canadians. But as other researchers have said, we've got a very poor nutrition in schools in Canada. There are other policies like menu labeling or sugar sweetened beverage taxes that our government still hasn't addressed, and the researchers are continuing. And I recently received a grant to look at the whole question of sugar in the Canadian food supply and free sugars, with a view to, if we were to introduce sugar sweetened beverage taxes, what types of products should be taxed. So I would say that as we go down this road of changing the food supply, we have to remember that it's not without the challenges, either to the researchers or to the regulators and the policy and into practice. For example, when Canada announced its regulations for front-of-pack labeling, the US actually raised it is part of the NAFTA discussions under free trade. Is that going to be an impediment to trade? And they tried to stop the Canadian government from introducing those regulations as part of the trade agreements. And I have a couple of clips from other articles, as you can see, that when various either cities or regions in the US tried to introduce sugar-sweetened beverage taxes, there was a huge lobby by the food industry against such taxes. And I will just say, we conducted some research, and I think this has been very important, and actually we shared it with government to say that once the healthy eating strategy was released, we actually went through the registry of lobbyists and the government database of all the interactions of both all interested parties in these regulations. And you can see that over 80% of the interactions and lobbying that occurred on the healthy eating strategy was by industry. And we were able to see many of the reports, and the vast majority were not supporting them. They were actually trying to offer diversion tactics against the regulations. So this is another part of research that really helps to understand not just what the science is, but how the environment is helping to shape or to interfere with the development of new regulations and new policies into shaping a healthy food environment. And so I just want to finish up by this figure to say that the transition or the pathway between research, policy, and practice is not a linear one. You have this interaction of the science with the health and consumer groups, with government, but also with industry. Each will then bring their perspective and help to shape that policy. And what we really want is resilient science, resilient policy to lead to health benefits for the consumers. And with that, I'd like to thank you all very much for listening. And I'm sorry I can't take questions, but it was a pleasure speaking to you today.